Regulation Review Subcommittee will come to order. As usual, if you would please silence your cell phones. Will the Secretary please call the roll?
Senator Rocky Adams. Senator Thayer.
Here.
Senator Yates. Representative Bridges. Here. Representative Fraser Gordon. Here. Representative Grossberg.
Here.
Senator West.
Here.
Representative Lewis.
Here.
We have a quorum.
Thank you. The first matter of business is approval of the minutes of the last meeting. Are there any additions or corrections to the minutes?
So moved. Second.
Seeing no additions or corrections to the minutes, do we have a motion for approval? We have a motion. Do we have a second? We have a second. Without objection, it is so ordered. Please call the first regulation. Excuse me, sorry. We have an introduction. I almost skipped past.
Yeah, so I got here early today and saw my good friend Rich Storm, Commissioner of Fish and Wildlife, and he's got a special guest with him today, Avery. She's a fifth grader, and she's visiting with her dad today and touring the Capitol. So let's make her all feel welcome.
Yeah. Yeah, she didn't look like cabinet staff or anything like that. Please call the first regulation.
Education and Labor Cabinet, Education Professional Standards Board, 16 KAR 4060 without additional amendments.
This regulation is being amended to remove references to outdated applications and expand the substitute teaching and higher education experience qualifications for certificate renewal.
Please identify yourself for the record.
Good afternoon. Todd Allen, General Counsel for the Education Professional Standards Board.
Thank you. There are no amendments to this regulation. Are there any questions from members on this regulation? Seeing none, I have one quick question for you. We've done a lot of work on this issue, teacher shortage, making sure we have enough teachers in the classroom. Just explain a little bit how this affects that. Are we requiring more experience at a time where we need more teachers in the classroom? Or I don't think this is doing that, but
No.
If you could just explain that.
Sure. So this regulation relates to renewal. So individuals who are already certified to be teachers, renewing that certificate. It actually provides some expanded opportunities there with regard to the experience that they're required to have in order to renew their certificate. This expands a little bit how a substitute teacher, that experience could count toward renewal. So previously it had to be, I believe, 30 hours in each semester. Instead of that being the case, it can be 60 hours regardless of which semester it would be in. It also expands some opportunities for renewal for folks who've worked in higher education. If they've worked at a educator prep program at one of our public universities as an administrator or something of that nature, that would qualify for them to renew as well.
So it sounds like this should do nothing but enhance the opportunity to teach and help with teacher shortage issue.
Yes.
Thank you, sir. Appreciate it. Please call the next regulation.
Department of Law, Kentucky Opioid Abatement Advisory Commission, 40 KAR 9010 Emergency and Ordinary and 9020 Emergency and Ordinary. Both ordinaries have staff suggested amendments.
40 9010 and Emergency and 9020 and Emergency establish the general application and local government application procedures for funding from the Kentucky Opioid Abatement Advisory Commission. The staff suggested amendments to the ordinary regulations amend various sections to comply with KRS Chapter 13A.
Would you please identify yourself for the record?
Blake Christopher, Senior Counsel at the Attorney General's Office.
I'm Brian Hubbard. I am the Chair and Executive Director of the Kentucky Opioid Abatement Advisory Commission.
Allison Shavies, Executive Staff Advisor for the Kentucky Opioid Abatement Advisory Commission.
There are staff amendments. Is there a motion for approval of the staff amendments? We have a motion. We have a second. Without objection, is so ordered. Do we have any questions from members? I believe Co-Chair Lewis has a question.
Thank you, Mr. Chairman, and thank you all for being here today. Looking over the public comments, there was a question on should a county or city misappropriate these funds? What is the recourse?
So I hate to give a lawyer answer, but I think it would depend, right, on the type of misappropriation. There are a number of potential things that could happen at this point. There are methods to sort of debit that against future payments. That's a possibility. There's a possibility of having to pay it back, right? Of course, depending on the situation and what I suppose further evidence would turn up, there's a potential that it could preclude future payments altogether. But I don't want to necessarily comment on and give a wide-ranging answer without knowing more about the circumstances. But my understanding and my recollection of the statute is the authorizing statute 15.291 and 293. In those kinds of circumstances, the commission is to refer those kinds of situations to the AG's office, who is in charge with investigating and sort of securing the integrity of these settlements. Because as I understand probably the basis of your question, misappropriation could put at risk, right, the $842 million some odd settlements that have totaled at this point. So I think it would just depend on what the situations were and also what kind of cooperation we received about moving forward and correcting the error.
Sure. Thank you. One follow-up, Mr. Chairman.
Sure. See.
Another portion of that comment section was also reporting requirements. I mean, there's going to be different dollar amounts, and of course, some of your bigger governments are going to be having more funds come in. If you're a smaller county, and let's say you're getting maybe 14,000, I believe the reporting requirements require it to be reported 4 times a year. Any discussion on maybe reducing that based on the amount of money?
So I certainly think that's something the commission can take a look at moving forward, right? And whether it wants to have alternative reporting requirements depending on the size of the locale or the amount of the settlement. I do want to note that part of that, I think, concern is addressed in the statute itself, is that if a city is going to get, say, a de minimis right settlement, it rolls up into the county. In order to, I think, to sort of prevent some of these reporting requirements from getting too obtrusive. And so if you're talking extraordinarily small dollar amounts that would go to a small city, that will roll up to the county, and the county will have the reporting requirement right at that point. I certainly think the commission can take a look at, and I won't speak for the commission members, but they can take a look at sort of amending that in the future to make sure that we're not being too intrusive into local governments. But I think the overarching concern here is just making sure that we have all the documentation we need to secure the integrity of the settlement if any questions ever arose about the appropriations of those funds.
Sure. Thank you.
I've got a quick question. So just for our information, you mentioned $842 million. So what is the actual number that's currently that we're looking at to be appropriated, for lack of a better term, appropriated? Or
so I'm just going off of memory off the last time I looked on our website. I think it's $842 million in sum over the course of the next 15, 20 years or so. Recall, according to 15.291 and 293, that's split 50%. 50% will go directly to the counties and cities. The other 50% will come to the Opioid Abatement Advisory Commission. This, of course, or that amount, of course, doesn't come in one fell swoop. It comes in over scheduled payments over the next 15 or 20 years. I think right now I'm trying to pull from recollection.
I don't need an exact number.
Yeah.
You answered the question. So it's half of $842 million roughly, but it's amortized over 15 years.
That's correct.
The company has the ability to make payments.
4 to 6 a year, that's what I was trying to recall, I think is what we're looking at, somewhere around that. And then, of course, as more settlements get added to that number, right, with more companies, the number of payments itself will increase per year.
Thank you. Any other questions from members? Seeing none, please call the next regulation. Thank you.
Boards and Commissions, Board of Dentistry, 201 KAR 8, 533, and 563, both with staff suggested amendments.
201 KR 8533 establishes requirements and procedures for dentist licensure and incorporates material by reference relating to licensure and the American Heart Association's guidelines for CPR and emergency cardiovascular care. 201 KR 8563 establishes requirements and procedures for dental hygienist licensure, including registration for local anesthesia, general supervision, intravenous access line, laser debridement, and public health, and issuance of initial licensure, incorporates material by reference. The staff suggested amendments for both of these regulations, amend various sections for clarity and to comply with KRS Chapter 13A, including to correct citations and delete references to a repealed statute, and update material incorporated by reference.
Would you please identify yourself for the record?
Certainly. Good afternoon. I'm Jeff Allen, Executive Director of the Board of Dentistry.
Thank you. There are staff amendments. Is there a motion for approval of the staff amendments? We have a motion. We have a second. Without objection, is so ordered. What we have before us is the reg as amended. Any questions from members on this set of regulations dealing with dentistry? Seeing none, please call the next regulation. Thank you.
Board of Nursing, 201 KAR 2360 and 390, both with staff suggested amendments.
201 KR 2360 amends to authorize the exclusion of nursing students from the graduation rate who have not completed the program of nursing due to documented extenuating circumstances, and update the annual report of the program of nursing. The staff suggested amendment amends various sections to comply with KRS Chapter 13A.
201-2390 amends provisions for the Kentucky Nursing Incentive Scholarship Fund to adjust award criteria to encourage application by pre-licensure students without a healthcare background, and revise the application form incorporated by reference. The staff suggested amendment amend various sections to comply with KRS Chapter 13A.
Would you please identify yourself for the record?
Kelly Jenkins, the Executive Director at the Board of Nursing.
Yes, good afternoon. Jeff Prather, General Counsel, Board of Nursing.
Thank you. We have staff amendments. Is there a motion for approval of staff amendments? We have a motion and a second. Without objection, is so ordered. Any comments from members or questions? Senator?
Thank you, Mr. Chair. Just looking through this, could you explain why that we would do this? Obviously, we want to make sure we have a clear picture of who's completing, and most of the time, if you don't complete, it's because of some extenuating circumstance. Why would this not give us kind of a false?
The way that we had calculated prior to this was based on a 1.5% rate. So what that meant was each program was having to keep track of every name of every student each spring and fall, or now they're doing quarterly sessions. So it was really getting so hard to accurately get a true percentage rate. The other thing is this puts us in line with the National Council of State Boards and how other states actually calculate that graduation rate. And now it is just a snapshot for us because we can only use this as a benchmark, as a reason why we might need to go in and do a site visit. As you recall, the last legislative session, we only now can, like what was perceived as a cap, but they can increase enrollment. It doesn't pertain to this factor anymore. The only factor that does pertain now is the actual NCLEX pass rate.
Okay, but you kind of answered. So this is the national standard, is what we're.
Yes, sir.
Okay, thank you.
Any other questions? Seeing none, if you could just further comment on that, how is that going? The implementation of the bill that we passed. Have we removed the cap?
Oh yeah, yes.
Go ahead.
This perceived cap, but yes, it is, and we have now. Lots of universities have obviously increased their enrollment, and that is great. We have now currently about 5,232 empty seats across the Commonwealth right now in our nursing programs.
Wow. Okay. Any further questions? Seeing none, please call the next regulation. Thank you.
Thank you.
Tourism, Arts, and Heritage Cabinet, Department of Fish and Wildlife Resources, 301 KAR 2015 and 90, and 301 KAR 4110, all except 301-2090 have staff suggested amendments.
301-2015 corrects the definition for feeding. 301-2090 amends provisions for hunting migratory game birds to clarify knowledge of baited areas and establish specific criteria for shotgun shells, as established in 301-2222. 301-4110 amends procedures to administer drugs to native wildlife, to clarify 3 definitions and other provisions, add to the detailed plan and timeline for administration, anesthetic monitoring, withdrawal time data, and potential human consumption risks, and add to waiver criteria the possibility of biological or chemical emergencies. The staff suggested amendments for 301-2015 and 4110 amend various sections to comply with KRS Chapter 13A.
Would you please identify yourself for the record?
Rich Storm, Commissioner, Kentucky Fish and Wildlife.
Stephen Fields, Staff Attorney for the Department of Fish and Wildlife.
Thank you. We have staff amendments. Is there a motion for approval of the staff amendments? We have a motion and a second without objection, so ordered. Any questions from members on this set of regs? Any comment? How's Fish and Wildlife going?
Well, we had a 10-year high harvest with turkeys, so that's good news. And I had my security detail with me today, and thank you for recognizing her. And she took her first white-tailed deer this past fall. So
oh my gosh!
Glad to have her with me today.
Nice.
Yeah.
Nice. So I know turkey season ended yesterday, I think.
Day before yesterday.
Day before yesterday. Yes. Always nice having you. Any further questions? Seeing none, please call the next regulation.
Transportation Cabinet, Department of Highways, 601 KAR 14050 without additional amendments.
This regulation is being amended to remove the requirement to use a cabinet
Would you please identify yourself for the record? It's still not on, I don't think.
Now it is.
There you go.
John Johnson, Assistant General Counsel, Office of Legal Services, Kentucky Transportation Cabinet. Thank you.
Jay Huber, and Program Administrator for the Motorcycle Rider Ed Program, Ride Smart Kentucky.
Thank you. We have no amendments for this regulation. Any questions from members? Seeing none, please call the next regulation. Thank you.
Education and Labor Cabinet, Department of Education, 704 KAR 8060 without additional amendments.
This regulation amends the material incorporated by reference to conform to the requirements of KRS 158-196.
Please identify yourself for the record.
Good afternoon, Todd Allen, General Counsel for the State Board of Education.
We have no amendments on this regulation. Any questions from members? Seeing none, please call the next regulation. Thank you.
Workers' Compensation Funding Commission, 803 KAR 30010 with staff suggested amendments.
This regulation is being amended to clarify and expand upon the Commission's calculation premium assessments. The staff suggested amendment amends various sections to comply with the drafting requirements of KRS Chapter 13A and make technical changes.
Would you please identify yourself for the record?
Lisa King, Executive Director of the Funding Commission.
Marcus Rowland, General Counsel of the Funding Commission.
There is a staff amendment. Is there a motion for approval of the staff amendment? We have a motion and a second. Without objection, it is so ordered. Any questions from members? Whenever I deal with workers' comp, I have a little flag that goes up in my mind. I'm an attorney, but I know enough to be dangerous when it comes to workers' comp law, especially when we talk about the calculation methodology. So my question is this a huge change that will affect a claim? Comment on that, if you would.
No. What this is to clarify the calculation of assessment. So insurance companies are required to pay assessment on all their insurance policies that write workers' comp in the state of Kentucky. They may pass it on to their insureds if they want to do that. But this does not have to do with the payment of the claims. And the calculations here are not new. What we're trying to do is be transparent and open as to what's going on. It's not been done in the past, and it's just good, it makes good sense and good business to be transparent.
And the assessments are related to what?
Workers' comp premium written in the state of Kentucky.
Right, they're assessed at, it's important that we know what that number actually is so that the assessment can be correct, right? That's what you're attempting to make sure of, right?
Yes. They pay in quarterly, and it is on a a voluntary basis, the companies do, and we work directly with insurance companies to collect this.
Are they audited at the end of the year to make sure that's correct?
Yes, we are on a 2-year audit cycle, and we
Okay.
audit the insurance carriers, not the businesses, but the
Right.
carriers themselves.
Gotcha. Thank you. Any other questions? Seeing none, please call the next regulation. Thank you.
Public Protection Cabinet, Department of Financial Institutions, 808 KAR 1170. This has an agency and staff suggested amendments.
808-1170, amend requirements for licensing and registration of consumer loan companies, check cashing and deferred deposit service businesses, and mortgage loan companies, brokers, branches, and originators to establish the process to calculate the annual assessment fee for a renewed mortgage loan company or broker. The staff suggested amendment amends various sections to comply with KRS Chapter 13A, amends Section 5 to clarify that branches do not have to pay the registration renewal fee individually, and amends Section 11 to insert a reference to KRS 12.357, which exempts military spouses from licensure fees under certain circumstances. The agency amendment amends Section 4.2C to revise the date to submit third quarter mortgage call reports from November 1 to November 14th, which is the date required by the NMLS data system.
Would you please identify yourself for the record?
Sorry, Jessica Sullivan, Assistant Director, Non-Depository Division.
Justin Burris, Acting Commissioner, Department of Financial Institutions.
Gary Stevens, Assistant General Counsel, Department of Financial Institutions.
There's a staff amendment. Is there a motion for approval of the staff amendment? We have a motion. We have a second. Without objection, is so ordered. There's also an agency amendment. Are there any questions or discussion on the agency amendment? Seeing none, is there a motion for approval of the agency amendment? We have a motion. We have a second. Without objection, is so ordered. So you have before you the regulation with as amended by staff amendment and agency amendment. Any questions from members? I've got one question. If you could walk us through a mortgage broker, the fee they're paying now versus once the reg flows through, how has that changed? What will it look like? If you could help us with that.
So I guess before this statute was changed, there was a initial application fee, an examination fee every time we went on an exam, and then a renewal fee based on the office locations that broker would have. Going forward, it's going to be based off of loan volume. So there's a multiplier in statute that is used to calculate the fee with a min and a max. That has taken the place of the renewal fee and branch exam fee, I should say. So there's only going to be one bill per year for each broker and mortgage company. So
was this, for lack of a better term, revenue neutral? I mean, was it an increased fee to most people? Probably.
It was. So I guess.
And this was because of a statute that we passed.
Correct.
Yes.
Correct. And we hadn't updated that portion of the statute and the fees for probably almost 30 years. So it was an increase. But given everything that's happened with the department as far as our fees go, I think that it was beyond time for us.
Any other questions? Okay. Seeing none, please call the next regulation. Thank you.
Cabinet for Health and Family Services, Office of Inspector General, 902 KAR 2480 and 490, both with staff suggested amendments.
902-2480 establishes the minimum licensure requirements for social model assisted living communities, healthcare model assisted living communities, and assisted living communities with a secured dementia care unit. The amended after comments version adds 5 new definitions, clarifies that reports of abuse, neglect, or exploitation shall be made to the OIG and DCBS, clarifies that delegating nursing tasks and the supervision of unlicensed personnel performing delegated tasks shall meet the requirements in 201 KAR 2400, clarifies who can be a contact person or legal representative, clarifies dietary service requirements, record-keeping requirements pertaining to volunteers, and background check provisions, establishes that an LPN may delegate nursing tasks and includes related provisions, clarifies the requirement for a nurse to conduct a face-to-face assessment with a resident prior to medication management services, clarifies provisions if a resident refuses medication management, allows certified medication aides to administer preloaded insulin in addition to other medications, and revises incorporated material. The staff suggested amendment amends various sections to comply with KRS Chapter 13A and amends Section 15.7 to comply with new credentialing requirements and Senate Bills 110 and 111. 902-2490 establishes minimum standards for licensure as a rural emergency hospital. The amended after comments version amends Section 2 to clarify that a rural emergency hospital shall obtain licensure prior to certification by CMS, and delete the requirements to obtain certificate of need approval prior to converting back to a critical access or acute care hospital. The staff suggested amendment amends various sections to comply with KRS Chapter 13A.
Would you please identify yourself for the record?
Representative Steve Bratcher.
Adam Mather, Inspector General.
Kara Daniel, Deputy Inspector General.
Stephanie Brammer Barnes, Regulation Coordinator.
Thank you. There are staff amendments. Do we have a motion for approval of staff amendments? We have a motion. We have a second. Without objection, it is so ordered. So we have before us what appears to be a complex regulation. Before I open for questions from members, Representative, did you want to speak on this in favor?
Just,
I'm assuming.
yes, sir. Just in, thank you, Senator. Yes, sir. I'm in favor of this. When we passed last legislative session, well, the one before, Senate Bill 11 basically recodified the assisted living organizations and put them into different categories. It was kind of unclear in the regulation how many categories there would be. I think there was originally 2. This makes sure that there's 3 categories. It includes Alzheimer's and dementia as one category, the medical models another category, and the community models another category. With that being said, the increase in allowing people to age in place requires more medical attention, which increased the amount of time they can stay. So therefore, the people needed to have more medical background to do so, as well as the facilities being in that mode. It also changed the allowed CMAs, which is certified medication aids, to administer from a preloaded injection for insulin. So 40% of the people in assisted livings and nursing homes now have insulin requirements, which would normally require a nurse to be on site. But from a preloaded injectable syringe, we were allowing them to do it themselves, which people with Alzheimer's and dementia or Parkinson's disease have if you can imagine the difficulty doing that. So the Board of Nursing supported this and has put together regulations to ensure that the CMAs can administer this medication without a nurse being on site but being available. So that pretty much in summary is the 2 biggest changes.
Thank you. Anyone else at the table wish to comment?
I think we're good. We'll take any questions you all have. Yeah.
You've been here before.
Yes.
Any questions from members on this set of regs? Seeing none, please call on the next regulation. Thank you.
Department for Aging and Independent Living, 910 KAR 1180 with staff suggested.
910-1180 amends provisions for the home care program to add definitions, revise case manager qualifications, add service appropriateness and safety monitoring, establish provisions to prevent reduction or termination of services without cause, add service planning, including involving the client in planning, and update the appeal process to include an informal dispute process. The staff suggested amendment amends various sections to comply with KRS Chapter 13A.
Would you please identify yourself for the record?
Commissioner Victoria Elridge for the Department for Aging and Independent Living.
Beth Reardon, Department for Aging and Independent Living.
Sarah Putoff, Department for Aging and Independent Living.
There's a staff amendment. Is there a motion for approval of the staff amendment? We have a motion and we have a second. Without objection, is so ordered. Any questions from members on this regulation? Seeing none, please call the next regulation. Thank you.
Under other business, we have Cabinet for Health and Family Services, 907 KAR 1038 emergency, 126 emergency, and 632 emergency.
907-1038 emergency amends Kentucky Medicaid program hearing provisions to implement a state plan amendment that allows adults to receive hearing services. establish audiology service limits through the incorporated fee schedule, increase the amount that can be charged per ear each 36 months from $800 to $1,200, clarify how hearing and batteries may be clarify how hearing aid batteries may be provided, clarify that new or improved technology may be a reason to reimburse for hearing aid replacement, establish that service and instrument limits may be exceeded for children under 21 if medically necessary, and update the fee schedule. 907-1126 emergency establishes provisions and requirements for Medicaid coverage of dental services. 907-1632 emergency amends Kentucky Medicaid program vision provisions to make technical corrections, including for consistency with 907-3005, implement a state plan amendment that allows for adults to receive vision services, clarify cost-sharing requirements in order for providers to deliver services on a non-medical basis, clarify vision service limits, require a higher quality of frames, lenses, and lens enhancements shall be available, clarify that contact lenses are covered and shall be available, and update the vision fee schedule.
Good afternoon. Would you please identify yourself for the record?
Hello, I'm Lisa Lee, Commissioner for the Department for Medicaid Services.
Hello, I'm Wesley Duke, General Counsel for the Cabinet.
Jonathan Scott, Row Coordinator, DMS.
Thank you so much. We, as chairs, requested that this reg be pulled and actually placed on the docket for information. Any questions from members as we get into this important set of regs? Senator Thayer.
Thank you, Mr. Chairman. Half expected Bill Murray to come to the table today because I feel like this is Groundhog Day. For those of you who aren't as old as I am, that was a movie starring Bill Murray where the same thing kept happening over and over and over again. So I've been back on this committee for just a couple of months, but I think every month since I've been back on this committee, you've been before trying to push through these regulations, which seem to me to fly in the face of the other branch of government, the one that we are members of, elected by the people to implement policy, to pass policy that you are supposed to implement. So with that in mind, I'm going to ask quite specifically, do these regulations comply with the provisions of the Chairman's bill, Senate Bill 65, relating to Medicaid coverage for dental, vision, and hearing services? That's part one. Part two is, how were these different from the previous set of regulations found deficient by this committee? And please do not avoid the question, because if you do, I will ask it again. Thank you, Mr. Chairman.
Well, I'll take the first part of that question and maybe segue into two. In regard to Senate Bill 65, it's our position that these regulations before the committee here today are substantially different. And that was, once again, that's in compliance with Senate Bill 65. They are different as far as each service provided, dental, vision, and hearing. And as we say, we think they're substantially different in regard to fee schedule, in regard to services provided, in regard to services covered, and in regard to rules about the provision of said services. So it's our position that they are in full compliance with Senate Bill 65. Now I'll turn this over to the Commissioner to get a little more some detail about the specifics of that as far as question number two.
So some specific changes in these regulations. For example, our dental regulation is definitely significantly different in that the adult fee schedule has been changed. Kentucky has two different fee schedules for our dental population. We have a fee schedule for children and a fee schedule for adults. The adult fee schedule is slightly lower than the children's fee schedule. Based on studies conducted by the American Dental Association, our child fee schedule is at 104% of the commercial rate. When we added these services to the dental population, we increased reimbursement rates for some of these services. All services that are being added are preventative and diagnostic in nature and designed to keep individuals with a full set of teeth to help them get back their smile. And the Vision regulations are different in that we've increased the quality of frames. We've updated the Medicaid vision fee schedule in several places. We've removed language that would allow providers to balance bill a member because that is not allowed under federal statute. So we want definitely to be in compliance with federal laws. Our hearing regulation is different in that our audiology services limits are set by the fee schedule. We increased the per ear limit from $800 to $1,200, and we allow for batteries to be changed if cost effective. So those are some of the changes that are significantly different than the previous regulations.
And I just like to add to that, all these changes that were just mentioned, and there are more. We're done in conjunction with our technical advisory committees in regard to these service provider types. So the similarity with this is only the vision, dental, and hearing services. The actual regulations are substantially different, and it's our understanding, it's our position that that's in full compliance with Senate Bill 65.
Senator Thayer.
Mr. Chairman, I have more questions, but I'm going to hold off for now, and I know other members may want to ask some questions, so I may come back to you later.
I'm going to jump in real quick while we're here because my question pertains to this, what you just stated. So, if we get this correct, you're stating the changes. Most of the changes relate to the fee schedules in each regulation.
Specifically for the dental regulation, the audiology regulation, and the vision frames.
And we've increased those.
Yeah, we have increased rates.
So the main change to be in compliance on Senate Bill 65 and Senate Bill 2, you have to have, there has to be a substantial change. But the change has been to increase the fees in most cases. Now, you talked about this was done after consultation with your technical review committee. Did you, at any time, act in conjunction with the Senate Health and Welfare Committee on this? Did you consult with them before you proceeded with the change?
No, we did not.
Okay. I'm going to allow others to comment, have questions. I'm going to go to Senator Yates first, and then Senator Adams.
Thank you, Mr. Chair. I was trying to take a couple notes. Was it said that this was necessary, these changes, to comply with federal law as written right now?
Some of the changes that we did implement were designed to comply with federal law. Specifically, there's no balance billing to a Medicaid member. So providers, for example, could not provide a pair of glasses, and I'm just going to throw out numbers, for $100 and only bill Medicaid for $50 and try to balance bill the member for the other $50. That's not allowed in Medicaid billing at all.
I remember when there was discussion on Senate Bill 5, one of the talks and worries that, and I think I'm in agreement with, is that we didn't have enough providers willing to provide the services out there. It looks like because of the increased rates that you added about close to another 1,000 dentists that are willing to provide services. Is that correct?
I would have to go back and double check that number.
Okay. Have you had more people, because of the increased rates, have you had more people willing to provide services to those for vision, hearing, and dental?
So just some preliminary numbers that we looked at before we came over. 37,157 individuals in the state of Kentucky. Adults now have glasses. Those are individuals who did not have glasses prior to. 1,390 individuals had dentures. And if I could just read a very small email, and this is one of many that we received from an individual. She states her name, and I'm not going to say that, of course, for HIPAA reasons. I have several dental problems and was scheduled to get all teeth extracted and dentures for both top and bottom. I've done all x-rays on April 21st, and I was going to begin impressions and have my new teeth by the end of May. I am 2 years clean and sober and am applying for a new state job in July. I have worked so hard to get where I am, and I feel great about myself, except for my appearance due to my teeth or lack thereof. This is a perfect example of why we need these services in Kentucky. We currently rank 49th in the state in oral health care. We can't continue to pay for the same services more and more and expect different results. We have to do something different. Our neighbors to the east of us Virginia has dramatically changed their adult dental benefit. And their services went into effect July 1st of 2021. They provide a full array of services to their adult population, including 3 cleanings per year. Our current population, we only provide 2. Prior to these changes, it was 1. So again, I think that just demonstrates the need for these services. And if we want to move from 49th up the ladder in our oral health care, we're going to have to do something different, and it's going to have to be for our adult population.
And I appreciate that. My final question is, when we have different come before us, you said that was done with the technical advisory committee on
Yes.
there, that kind of looking at best practices or whatnot. Who would that make up? Who would be part of that, of the advisory committee?
The Technical Advisory Committee, we have several technical advisory committees. We have a Dental Technical Advisory Committee that's made up of dentists around the state. Same thing with vision and hearing, made up of different individuals. And those TACs report up to the Medicaid Advisory Council. And so they make recommendations to the MAC, and then the MAC brings those recommendations to the department.
Thank you.
Senator Adams, before you start, I got a quick question, then I'll hand it over. Last time we had the regs before the committee, the price tag, I think we had it set at like 38 million, I believe. Most of that coming from the savings from Senate Bill 50. Go ahead, correct me if I'm wrong there. Does that sound accurate?
That we do have some savings from Senate Bill 50, therefore we did not need an appropriation. We feel like this is in our current appropriation. We have the total is $36 million, 31 million of that coming from the federal government, good, great return on investment, and 5.6 coming from state dollars.
So with the increase in the new rates in this version, what was the initial price tag, and then what are we at now with this new expansion?
I'm not sure if I understand the question. Are you asking?
So you gave us a price tag last time you were here. This is what it's going to cost.
Mm-hmm.
And now you're telling us with the changes here, this is expanding services and increasing rates. So I would assuming that's going to be a higher cost. So what was the cost last time compared to what the cost is now?
And I think I don't think we have the exact number here for as far as this, as far as the regs are here today. However, I don't think there's any concern that it will fall outside of what the savings are already being generated, that we'll be able to absorb it without any additional appropriation.
And most of that is because the managed care organizations serve 90% of our population. Managed care organizations are paid a per member per month capitation payment, and they have to provide all the services that are outlined in our benefit package. So the MCOs will be using that PMPM to the per member per month to pay for these services, and it should not be an increase as we go forward.
Senator Adams.
Thank you, Mr. Chairman. I was going to ask the question along the same lines as that you did, and that is cost. I mean, if we are increasing the rates in order to expand these services, you're saying that this additional expansion is not going to create additional costs. Is that your testimony?
That we believe that the additional, giving the slight increases that we did not do an across-the-board raise. We did some slight increases for specific codes, and we don't believe that will result in a significant or increase in the projections that we made earlier.
Has Medicaid decreased rates in any other category recently?
Medicaid bases a lot of our rates on Medicare. Medicare did reduce some rates in our behavioral health program. So our behavioral health services, we used to have an inpatient and an outpatient fee schedule. It was a little bit confusing. We combined those into one behavioral health fee schedule, and if the rate on one fee schedule was higher, we chose the higher rate. We did not reduce any rates. The only time we reduced rates was a very small portion of codes, procedure codes, that were reduced by Medicare. Because our fee schedule is tied to the Medicare fee schedule, our rates reduced at the same time the Medicare rates did.
So 2 follow-ups, Mr. Chairman, on that. So you did decrease the behavioral health reimbursement rates in certain categories. And what is the savings on that reduction in the behavioral health rate cuts?
I would have to go back and double check and see how much the rates were reduced and look at those specific codes.
Okay, and now let me ask you this. So you are basing your rate cut for behavioral health services on the fact that Medicare required it. But don't we set regulation for behavioral health Medicaid rates through our own regulatory process? This is not from my understanding, this is not a federal government requirement, that we did not have to cut those behavioral health rates if we took care of it within our own regulatory framework, correct?
Our regulation that covers behavioral health specifically references the Medicare fee schedule. So it is in our regulation. CMS requires that our rate methodology be based on some sound methodology, and one of those methodologies is tying to the Medicare fee schedule. So our rates, because our rates are in our regulations, outlined that we tie ours to Medicare, we have to be in compliance with state law. We would have to adjust our rates whenever Medicare adjusts their rates.
So we could adjust that through our own regulatory process.
We would have to change our regulation to look at the percent of Medicare, what percent of Medicare we're paying. We tie to a very specific, Kentucky-specific Medicare fee schedule.
I look forward to seeing the reg that raises back those behavioral health fee schedules. So I look forward to seeing that in the interim. I'm assuming you're working on that too.
We are definitely working on a behavioral health rate study, particularly around children's services. For example, I am in routine meetings with other Medicaid directors across the nation. There is a huge issue right now with PRTFs. Several of our surrounding states are changing their PRTF rates. They are looking at some of their policies because some PRTFs are taking out-of-state children. So it's not about the money, because when a state sends a child to another state, they pay more. They negotiate rates and they pay more than the state fee schedule. We're not seeing children from out of state coming into Kentucky, which is a little bit of a concern because it means we don't have the array of services needed so states are not targeting us to bring their children in. So we're very concerned about that. We are looking at it. We have talked to other states. They are making changes. For example, they are increasing their PRTF rates, and they are making provisions that that the PRTFs have to have an 80 or 90% in-state census, for example. They can't take those from out of state. So something that we are definitely looking at.
Okay, and Mr. Chairman, I promise I'm not getting too far off vision, dental, and hearing, but the commissioner just brought up something that I think needs to be just vetted for a moment, and that is how many children are we sending out of state with the exact same, I know we're not receiving children, but we are sending children out of state. How many kids do we have out of state right now when we have empty beds?
Prior to 2011, when we expanded Medicaid managed care, we had over 200 children in out-of-state facilities. We brought on managed care organizations, and one of their charges was to decrease that number. We got it down to 0 at one point. And then we have one managed care organization, which is Aetna Sky, to serve our foster child population. That has helped reduce. And I think at the last time it was under 30, but getting close to 30 individuals.
So we have 30 that are being cared for out of state.
That I believe that number is about 30.
Okay. And then my final question is back to dental. How many providers do we have in the dental program in our rural areas?
I would have to go back and get that number for you, but I'd be more than happy to send that.
I'd love to know that. Thank you, Mr. Chairman.
Thank you. Co-Chair Lewis.
Thank you, Mr. Chairman. Two questions. When these regulations were before us last time, they were also emergency regulations with them, and with that, the basis was a press release from the governor's office from September. I believe the emergency regulation was filed December 29th. There are emergency regulations here before us today. What's the basis for it? Why is it an emergency?
Well, we know, for example, that dental services, oral health services have a direct impact on an individual's overall health care. We know that poor oral health leads to heart disease, diabetes. Those are diseases that are very rampant in Kentucky. Also leads to preterm deliveries. These services are very vital for individuals to improve their health care, also very vital to get them back in the workforce. The email that I read, that was a very specific example of individuals who have got to get their smiles back. They have got to get their confidence back in order to go and have an interview and be productive in the workforce. And so we believe that these are very vital services to improving the health status of this state. In 2011, we ranked, no, it was 2014, Kentucky ranked 47th in the nation in overall health care. 2014, we ranked 47th. 2022, we now rank 43rd. So we have increased our overall health care status, but we remain 49th in oral health care. We have got to get something done here. We have got to improve the health status of our individuals, and the only way we're going to do that is by thinking outside the box and doing things a little bit differently.
And I would also like to kind of add to that, Senate Bill 65 had a provision, it came in late, that allowed us to pay for services that had already been initiated, and which was a wonderful thing, and I think that was great. And I think that just accentuated the emergency, that there were services that were being utilized, and to stop any gap that might have happened between those that had been initiated and future services. That was part of the emergency regulation thought.
Follow up, Mr. Chairman.
Please proceed.
So the second time it's mentioned that, doing the same thing over and over and expecting different results. As you pointed out, we are 49th. And when this originally came up, I spoke to the providers in my district. And, of course, I do see that you have made some changes to the regs, fee schedule increases, making sure that they are willing to accept and perform these services is a big one. The contact lenses, that's another big one. I can only speak for myself. I mean, I'm not necessarily opposed for doing this. I think there's a lot of great things, and there's a lot of people in my district that could benefit from this, but the process matters. But I am curious, though. You mentioned earlier that through the Medicaid Technical Advisory Committees that these suggestions were made to you all, correct?
Yes.
Could you provide us with the meeting minutes for those meetings?
Yes, I can. They're
Thank
all
you.
posted online, but I will get you those meeting minutes.
Thank you.
I'm going to jump into a couple questions real quick, and then Representative Fraser Gordon, I'll come to you. My next line of questioning will be other areas, other Medicaid areas that you serve, okay? And so if you could comment, what is the process for rebasing the Medicaid rates for nursing facilities? And how is that going currently?
That's a very technical question, and I would need my CFO to answer that question. I could get something to you in writing on how we rebase. I believe it's spelled out in regulation, but I could get information to you on that topic.
Are nursing facilities satisfied with their current rates as they stand now?
No, they are not, but we are working with the nursing facility organizations to look at those rates.
We have House Joint Resolution 38, which urged the Cabinet to increase Medicaid reimbursement rates for ambulance services. Have you done that? Has the Cabinet done that?
I'll start, and Jonathan may have to, but I believe that we have. There is an ambulance tax. The ambulance providers are actually paying the state match on those increases, but we have increased the ambulance provider reimbursement, and we are currently, based on the Emergency Medical Services Task Force, we are currently looking at and preparing a state plan amendment or waiver to treat, triage, and transport individuals. Currently, our ambulance transportation, we only pay if they go to a hospital or to a facility. The treat, triage, and transport will allow ambulance providers to either treat on site or transport to a different facility, such as a provider's office or an urgent care center.
Yeah, I believe there's a Medicaid waiver for this. Have you all applied for that Medicaid waiver?
We are talking to CMS, and we believe we may be able to do it as part of a state plan amendment, so we're going to go which route would be the best.
So now I'll get into the waiver question, the Michelle P., those types of waivers. This comes up every year, and if you notice the Senate floor discussion on Senate Bill 65, Senator Carroll specifically spoke on we need to pull down more waiver funds. So there's a pretty hefty federal match there. So just a little bit more investment, we could pull down quite a few more waiver slots. Is that something that you all have looked at
We continue to
with
look.
monies?
Yes, we continue to look at our 1915C waivers. As you know, these waivers serve some of our most vulnerable populations. Those are individuals who need assistance in living in the community and who would otherwise be in a long-term care facility. We are doing rate studies again for the waiver population and looking at a variety of things to help assist those individuals in the waivers, and not only the waiver members but the providers as well.
So we've talked a lot about priorities today, and clearly dental care is very important. Kentucky does not want to be 49th, that's for sure, and that should be a significant priority. But there are other, as we've listed here and outlined, there are other things we could look at when it pertains to Medicaid, the emergency services, nursing home rates, these Michelle P. waivers, therapy services. You all could issue a regulation today that moves more money into therapy services. And so as we've talked about, priorities, who do you all think should set these priorities when it comes to appropriation, when it comes to decisions? Should it be the cabinet or should it be the legislature?
I think it has to be a joint effort. We are all here for the same reason. We are here to improve the health status of those we serve. Unfortunately, 1.7 million people in Kentucky currently live at or below the federal poverty level. Nothing to boast about, because that means that 1.7 million people live at or below the federal poverty level. And the average cost of living in Kentucky is about $43,000 a year. A family of four can only make $41,000 a year before taxes to qualify for Medicaid. So I believe this definitely has to be a joint effort for us to discuss some of our priorities. And I would definitely welcome any senator, any representative to the Medicaid Advisory Council to meetings to see how those go, to talk, to listen to the process. And I think that would be one area that we could use to get everybody at the table and listen and get information and find out what we need to do to move the healthcare needle in this state.
I'm happy to hear that. I totally agree that this should be a joint effort, agree 100%. In our February 14th, 2023 meeting, that's the meeting of this committee where we found this reg deficient, February 14th. After the regs were found deficient at that meeting, we met in the hallway out here, and you asked me, what can we do to work together? What can we do to get these regs further down the line? And I stated specifically that the first thing you need to do is to speak with Senator Meredith as chair of the Health and Welfare Committee. Did you all, during session or any time past that, did you go into his office? Did you reach out to Senator Meredith or any other legislator on these regulations?
I personally did not. I do know that there were cabinet officials who did talk with representatives and legislators during the session. And there were some conversations before the regulations were refiled.
So certain members of the cabinet had conversations with certain members. Okay, but no one specifically went to Senator Meredith.
I'd have to double check. I would have to double check.
Yeah, I think we need to confirm that, but it's my understanding is that Senator Meredith was contacted about this. But I will confirm that. I'm not going to say that for sure, but I feel fairly confident that he was.
And what did he say?
I'm not privy to what the details of the conversation were. I apologize for that.
So wouldn't a good person, if you're trying to have a team effort and work together on an issue, I would think that the chair of the Senate Health and Welfare Committee would be a very important person to talk to about this. And good or bad, you should probably know what they have to say. I'm gonna hand it over to Senator Thayer for now.
Yeah, thank you, Mr. Chairman. It's interesting to me that you use the term joint effort as a representative of the Beshear administration that has had less of a working relationship with this General Assembly than any governor in modern history. And I was first elected when Paul Patton was governor. So I think I speak from experience when I say this administration has no clue what the phrase joint effort means. I think the chairman has pointed out that there's been a lack of communication with our Senate committee chairman, Senator Meredith, who ran a hospital for most of his career. So I would say he probably knows a lot about Medicaid. Now, I don't profess to know a lot about it. It's not in my wheelhouse. I think probably you're jumping the gun here when the current programs we have are underfunded. But I'm also sitting up here in the top row and looking at the back of the head of someone who used to chair the Health and Welfare Committee, Senator Rocky Adams, who has probably sponsored more bills in the health and welfare and Medicaid space during her time here than any other member of the House or the Senate. Her office is right next to mine. I don't know of much collaboration or joint effort that's taken place. So I just feel like, maybe your calls for joint effort are kind of ringing hollow with me today. So I know there's more questions, but I will have a motion when the time is correct, Mr. Chairman, if you'd like to call on me to make it. Thank you.
Senator Adams.
Thanks, and I need to just speak up, talking about collegiality and working together. I respect you. I respect you have a very difficult job. I respect Secretary Friedlander. But in the spirit of collegiality and working together, I sent the Secretary a letter weeks ago asking about the cut to the BHSO rates. Weeks ago. I haven't gotten a phone call, I haven't gotten an email, and I haven't gotten a letter. And so, again, you can't talk out of both sides of your mouth. If you really want to collaborate with us, then let's collaborate. We're here. Y'all know my number. Thank you, Mr. Chairman.
Senator Yates.
I just wanted to make sure I was correct, and it's dangerous when I try to do math over here. Is 86% of the cost being fit by the federal government? It's about 6-to-1 match.
Yes, it is.
Thanks.
Any other members? Representative Grossberg.
Mr. Chairman, may I speak before the esteemed senator behind me and to the right makes a motion?
You may.
All
Please
right.
proceed.
I'm relatively new to the game, both in terms of this committee and to being a legislator, and it's clear to me that there's a lot going on that is subtext, isn't quite being said, but some discomfort between both the General Assembly and the cabinet in this case. But that said, having sat through the previous meeting in which the regulations were found deficient, I've seen substantial change. And, words that don't ring hollow to me in today's statement are that what is being proposed today is not a policy change, it is a regulatory change, that there are substantial fee increases, that everything being proposed is in compliance with federal law, and finally, and probably most importantly, that any potential cost could be absorbed without any appropriation from the General Assembly. But if we want to take a 30,000-foot view, nearly 90%, as Senator Yates said, 86% of the cost is going to be absorbed by the federal government, with only 14% by us. So we get $36 million at an expense of only $5.8 million. And let's listen to what we've gotten so far. We've gotten 60,000 Medicaid members who have received glasses who would not have otherwise received glasses. 932 dentists have received reimbursements for crowns on more than 5,600 individual members who would not have otherwise been reimbursed or received crowns. We have nearly 1,200 members who have received dentures who would not otherwise receive dentures. And providers have received over $11 million they would have not otherwise yet received. And in a state where, let's just take dentistry alone, we rank 49th, something's got to change. We may be having an element of Groundhog Day, and I'm a few years younger than Senator Thayer, but I remember the movie as a kid. Thank you, Senator. But I do remember, and I thought it was a horror movie at the time. But we're living it over because neither side's willing to give, and it's clear to me that at some point these meetings that the senators have spoken of need to take place, and other changes need to take place. But at this point, I think that we need to allow these regulations to pass through, if for no other reason than the dental regulations. Dental changes not only someone's oral health, but their economic health and economic opportunity. The first thing you see when you shake someone's hand is their smile, and it can make the difference to whether or not someone gets a job. If you talk to any cardiologist or any neurosurgeon, they'll tell you that the leading causes of heart disease and of vascular disease in the brain are directly correlated to dental health. We also live in a state with a terrible opioid epidemic, and it shouldn't go unstated that the primary cause of prescription-based opioid addiction is someone who fails to receive proper dental care and gets addicted to their legally and appropriately prescribed opioid medications. If these people had preventative dentistry and corrective dentistry, I can't give you the exact numbers, perhaps the people on the panel could, but we would save those addictions, save those lives, and the countless lives that each of those people impacts. So I'm not going to defend the actions that took place before I was on this committee. I can't defend meetings that didn't take place that probably should have, but I can defend the regulations that I see in front of me, and I have no reservations in finding them not deficient. Thank you, Mr. Chairman.
Thank you. I apologize to Representative Fraser Gordon. I skipped over you earlier. Please proceed.
Oh, fine. Thank you, Chairman. Yeah, I'm aggrieved. But no. I just wanted to speak in regards to the hearing regulations. Of course, that's no surprise. I did want to thank you for the work that you've done because the fee schedule was vastly improved, and I think it will help with coverage. I know there has been a lack of audiologists in general, but especially those that that accept Medicaid for payment. So I just wanted to appreciate that. And I had submitted some questions, and you very graciously provided those answers, so thank you for that as well. But I did want to bring out 2 points. One, in regards to the medical referral that is necessary when submitting for approval, because as you stated, the DMS amended to remove the mandatory physician, and I just wanted to reiterate, we're a doctoring profession, and we are the ones that are specifically counseled and trained and educated in testing, evaluating, and recognizing diseases of the ear. And so with audiologists and hearing aid dispensers, that's 2 groups of people. So I would really advocate for the removal of that, because that is one thing that slows down the process if we're trying to look at providing this service. The other thing is because of that we have to send a copy of manufacturer's invoice. We're not we can't submit claims electronically, so we have to do those by hand. And so those are just 2 things that I would like to see moving forward, if they could be considered, please.
Representative Bridges.
Thank you, Mr. Chair. I sat here and listened to all this, and I just want to go back and possibly look at some dates, because you said you want to work together. We look at December 29th, 2022, when these regulations were found deficient, and we can quibble on identical. They're definitely not identical But for a substantial difference, I passionately disagree. And when you talk about working together, that's fine. We need to work together. But what you fail to do is the ultimate decision rests with the General Assembly, if I'm not correct. And that's not what's happening. December 29th, February 14th, March the 30th, all of these, you kept coming back after we said no, we said no, we said no. And you don't want no. So you're going to do what you dang well please and give no credibility to the authority and where it rests. That's what the problem is. We want to bring health care to all Kentuckians. But of your own numbers, and we talk about the Michelle P. waivers, we talk about the SCLs, as of October 22, numbers from your group, we've got 10,000 individuals, about 8,000 with Michelle P. waivers. We got 3,000 with the SCL. Core medical services that are not being serviced. And you put them on the back burner. You said you're looking into them. Not near as fast as you looked into these. And these are core medical services, and you're failing these people. And instead of trying to take care of what you're already attending to, you want to start something new. That's unacceptable. That is unacceptable. You've been requested to contact Health and Family Services, work with them. I think we did. We could. I'll have to get back with you. That's everything we've said here and heard every day. I'm not for sure, Chairman. I'm going to have to get back with you. I think there's a blatant move against the legislative intent. Our intent has been loud and clear for several months now, and you have blatantly ignored it and try to work around it, and that's inexcusable. That's all I have to say, Mr. Chair.
Thank you. Quick question on the waiver slots. What is the federal match on those waiver slots? Michelle P. and others.
Typically 70% on the waivers, and it depends on the services and anything administrative. For example, if we have a contract, that would be a 50% match on it, but typically around 75% for the waiver slots.
Is there what's the federal match on nursing facilities? Is that how does that work in the rate when they're compensated? Is it just a straight payment to the nursing facilities?
Yeah, typically services in the Medicaid program, the match rate varies. For example, if we are serving the general Medicaid population, is about 75%. CHIP children who are enrolled in our Children's Health Insurance Program, federal government pays 80% for those. And anybody in the Medicaid Expansion Program is 90% federally reimbursed. Reimbursement rates are very complex, but yes, the nursing facilities are typically around 70%, I believe.
So to follow up on Representative Grossberg's comment, we're pulling down 60% match from the feds with what you're doing. Is that what you stated earlier? Correct me if I'm wrong.
It's a little over 80%.
Okay, I'm sorry. Maybe it was 75 or 80. I'm sorry, I missed that. We're pulling down a significant federal match. But it's safe to say there are clearly other areas that if we could take this money, put it into other areas, and also pull down a federal match. Like, for instance, if we want to invest this money, this $5 or $6 million that we're spending on this expansion, if we wanted to apply it to Michelle P., we could pull down a 75% match. We could pull down a nursing home match. We could pull down other matches if we wanted to. Is that safe to say?
Well, the services, we believe that we're being very strategic. The services that we're providing today, we know, for example, that we spend $9 million per year in ER services for children, for adults with dental pain. We hope to offset that cost and have services delivered in the right area at the right time. So we believe that we're making a return on our investment by investing this money in areas where we can see a reduction in services, cost of the healthcare services in the future.
I think that's where the breakdown is, that you feel you're being strategic, and I get that, and you should be. But members of the General Assembly, I think they feel they would be strategic as well, pushing it towards more core services, emergency service, getting people to the hospital, nursing home care, Michelle P. slots, things of that nature, really core services. So isn't that being strategic also?
I think that everything that Medicaid does is core services. Our services that we deliver to our 1.7 million individuals has to be medically necessary. So where do you draw the line at what's most important?
Any other questions from members? Seeing none. Senator Thayer, did you have a motion?
Thank you, Mr. Chairman. First of all, Representative Grossberg, you are way years younger than me, but I am impressed with the fact that you remember the movie Groundhog Day, and I find it interesting that you would equate it to a horror show, because that opens up a lot of statements for me to make in this meeting here today, but I'll refrain. You know, we have 1.7 million people in this Commonwealth on Medicaid, and one of the worst workforce participation rates in the country. It's embarrassing, frankly. You know, Medicaid should be for those who truly need help with their health care, and a transitional phase for those who are trying to get back into the workforce. But we can't afford the Medicaid program that we currently have. Expanding services right now is flat out irresponsible when we can't afford to pay for the programs we currently have. But I know it's an election year, but I think it's irresponsible to play politics with people's health care. And so, Mr. Chairman, I would like to make a motion that these 3 regulations discussed here today be found deficient by this committee.
Motion is for us to find these regulations deficient. Is there a second? Senator Adams has the second. Is there any discussion on the motion to find these regulations deficient? Representative Grossberg.
Senator Thayer said that we can't afford this. I think we can't afford not to do this. Thank you, Mr. Chairman.
Senator Yates.
I think being in a poor state, Commonwealth of Kentucky, we have to make a lot of tough decisions. A lot of times that we make decisions based on moral reasons, some are economic reasons, but I think one of the primary tenets of our government would be public safety and public health. We know that we're embarrassed to where we rank from a public health standpoint, and that should be a very, very top priority. Our moral compass is our budget. It's where we're held accountable. That's where we put our mouth it's where we put our money where our mouth is. And right now, if we do not provide these services, there's a lot of people who are going to go without very, very basic health care. We know that there's a negative economic impact. So if it was a business, we'd be looking at the economic impact, because when they don't have the dental services, they go to the hospital. When they go to the hospital, that still costs our taxpayers money. By being proactive in doing this, we save money. But if we're up here upset about the process, I get it. I as a legislator, I want to make sure that I protect my lane, but not to the extent that I'm going to hurt my constituents.
Representative Bridges.
I'd just like to end on this. The General Assembly expanded services for community health workers, for example. And in doing that, we used real-time Kentucky-based data that showed the return on investments and the quality improvement metrics. We did that. A lot of this up here is you think you're being strategic, but do you have any Kentucky-specific data that shows these regulations will increase workforce development, since we brought workforce development up?
Representative Bridges, do you mean workforce participation?
Yes.
That in the documentation. There are several studies that show that services will increase workforce participation, and we have some in our discoveries. So we can get you surveys. We can get you information that shows that individuals with a confident smile are more employable. There have been several studies that link participation in particularly Medicaid dental services to increased workforce.
One more.
Please proceed.
That's fine and dandy, and I'm glad of that. It is encouraging to hear, but here, and I'm going to quote a former legislator. Here we go again, at the last hour, on the last day, and you have it, and we have not seen it. That's not communicating. That's not working together. That is not being co-partners, and that is another example of it's inexcusable, not acceptable. So, thank you, Mr. Chair.
Any other discussion on the Senator Adams?
Yeah, I guess I'd just like to end on this. You know, we hear that this is something that we have to do. So we're expanding this program when at the same time we are watching in real time the BHSO rates being cut. We are watching the fact that we are not getting money from kids coming in from out of state, which raises those dollars. We are sending kids out of state to receive care, which costs a whole lot more than keeping them here in beds that we have open. We haven't taken care of our nursing facilities. So here's what we're doing to date, is we are pitting all of these various groups against each other. And that's not the right thing to do. What we should be doing is having a holistic conversation about how do we appropriately raise rates to take care of our most vulnerable population, so that we don't just have one winner, that we can have a lot of different winners. And so with that, that's all I have to say.
Any other, Representative Lewis, I think, has discussion point.
Thank you, Mr. Chairman. So I went back and looked on the basis of emergency. There are 8 different reports that were submitted. Again, the prior emergency basis for emergency was from a press release from the governor's office in September of 2022. What has been submitted now is 3 reports from 2018 stating it's an emergency, and then 3 reports between 2011 and 2015 when Steve Beshear was in office. I would argue not an emergency. That being said, I mean, I believe in procedure. I believe the funds being appropriated are not being appropriated by us. I take issues with that. I agree with a lot of what you're doing. I do, and I think it's a matter of us working together. And so the past 2 months, I've been working with A&R Chairman Petrie. He is immensely interested in this going forward into the next budget year. I've talked to Chair Moser. I know she has extreme interest in this. I've talked to my co-chair. I've talked to Senate leadership. I've talked to House leadership. We are all interested in having discussions, and I think it's a matter of coming together, but not refiling regulations just as soon as we leave. I'm not with that, but I do look forward to having more productive conversations in the future. Thank you.
Any other members seeking to add discussion points? I'll just make one final comment before we vote. In my opinion, this is my opinion as a member now, this deficiency vote has nothing to do with the regulation itself as far as expanded dental services. I think every single person up here on this committee would be in support of expanded dental services. I don't think there's any question about that. But our job in this committee is to protect the legislative process and protect the legislative branch and our role in the process. I don't think we would be here if there was some level of effort from the cabinet to meet us halfway, to discuss it, to show up in our office and work through this thing together. But in my case personally, there's been none of that. And since we're talking about emergencies today, we have a mental health emergency. If there's anything that's an emergency in this state, it is the mental health of Kentuckians. And so we talk about mental health emergency, mental health care, addiction care when it pertains to mental health, and we're cutting reimbursement rates for mental health. So we see that as a priority, a very important priority. So that's the backdrop. Really, I feel like the cabinet has left us no choice but to go down the path that we're heading down. So with no further discussion, the question is on the motion to find these regulations deficient. All those in favor of finding the regulations deficient will vote aye. Those opposed will vote no. Please call the roll.
Senator Rocky Adams. Senator Thayer.
Aye.
Senator Yates.
Please proceed.
I think obviously I can see the writing on the wall that this will be declared deficient. I am hoping, though, that I'll take my colleagues at their word that we will be working on a holistic conversation to be able to raise the rates to address all this. And we'll trade cell phone numbers when we leave, and hopefully we'll get everybody to the ground and work on this stuff, because if we don't, there's going to be a whole lot of people hurting. My vote's no.
Representative Bridges.
Explain my vote.
Please proceed.
Please understand, I am all for as much health care as we can put out there. But if you negate the process, the kingdom tumbles and crumbles. You say you want to work together. We're going to take you at your word. I will vote for the deficiency, but I would encourage you to follow the due process that's set before you and understand the intent of the General Assembly and the legislative process. And with that, I'll help you any way I can. But the process has got to be in the right order. And I'm sorry that some people are getting hurt over this, but I also know that there's other people that are not getting services and they're being overlooked because of some of the decisions that could be made. So, thank you, Mr. Chair.
Representative Fraser Gordon.
I'm abstaining due to my professional career.
Representative Grossberg.
Permission to explain my vote.
Please proceed.
We are being told that this vote has nothing to do with the regulations, but rather has to do with process. I can't overlook the consequences of finding these regulations deficient because it's going to impact millions of people. So I am a hard no, but like Senator Yates, I can see the writing on the wall, and I truly hope that both sides are sincere, that we can work together, that the meetings that should have taken place do take place, that there's a more open dialogue, and that politics can be put aside for the betterment of literally millions of Kentuckians, and I vote no. Thank you.
Representative Lewis.
Yes.
The committee will stand at ease for one moment.
And Senator West.
We'll stand at ease for one moment. Some of the confusion is some folks say they signed up to speak, but we did not receive that up here. So we're not going to allow that this time. We're too far down the road with this vote and with this process. So I apologize, but we had no notice that you were signed up to speak. That's my understanding. These regulations will be heard twice more, the ordinaries, so you're welcome to go back next month and comment at that time. But I apologize, I had no record that you were signed up to speak. So I didn't know to call on you. I apologize. So at this time, I'm going to explain my vote. I vote aye. And the committee today, by finding these deficient, this will be the second time that this committee has voiced its concerns, has voiced its opinion. The legislature also voiced their opinion with Senate Bill 65, the House and the Senate. Senate Bill 65 went through committees in the House and the Senate. So the legislature has made it very clear where we stand on this issue, very clear. And we have again today, if this carries. I'm going to make this statement as the chair. If the cabinet chooses to move forward with this and implement this regulation, they have the power to pull back, to pause. Any negative effects suffered by Kentuckians through a future pullback will rest squarely at the feet of the cabinet and the administration. That's my opinion. I proudly vote aye.
We have 5 yea votes. The motion carries.
The vote totals are, once again, say that louder, please.
Yes, 5 yea votes, 2 no votes, and 1 pass.
Motion carries. Any further business to come before the committee?
Our next meeting is the 13th of June at 1 p.m.
Any further business? Seeing none, this meeting is adjourned.